Hey there, Dr. Neil here. In this video, I want to talk about some of the negative effects of getting a poor sleep. In the last video, I talked about 7 benefits of getting adequate sleep. So if you missed that one, make sure you check it out. Some of these are the opposite, but there's a few different ones in here, so make sure you pay attention to this one. I'll put the graphic up here. You can take a look on your own here too. Memory issues. When you sleep, your brain forms connections that help you process, remember new information. Lack of sleep directly affects short and long-term memory. And that's a really important one, of course, for our mental health, our longevity. Even mood changes. Sleep deprivation can make you moody, emotional, quick-tempered. I'm sure all of us have experienced that. I have 4 kids, and they're not in little baby stage now, but there's times when we didn't sleep that well, and we've all again experienced that, whether you have children or whether you don't. Weakened immune function. This one I talked about the first time around in that previous video. Cytokines are released when your body is sleeping. Those are immune cells that are important in communicating what needs to happen, repair, rebuilding, if there's trauma or inflammation or infection, and those do not work as well. They're not communicated as well or released the same way when you don't get adequate sleep. That's a really critical one too. This one I did not talk about, risk for diabetes. Lack of sleep affects your body's release of insulin. People who don't get enough sleep have higher blood sugar levels and an increased risk for type 2 diabetes. That's a really critical one, as you know about. Low sex drive affects libido in men. Decreased sex drive is probably because of testosterone levels decreasing. I mentioned trouble thinking, concentration. That goes along with the memory issues. There's just lack of clarity, lack of ease in our brain function, our mental health as well. Accidents, obviously, if you're not able to focus, you're not able to concentrate, you're more likely to have an injury or an accident, whether that's even just driving your car, operating machinery, maybe you do something like that at work. Those are directly affected by sleep. If you sleep less than 5 hours a night, your risk for high blood pressure increases. There's another one, similar diabetes. There's direct evidence going when you don't sleep a lot, you have a higher risk for diabetes, you have a higher level of blood pressure. Weight gain. With sleep deprivation, the chemicals that signal to your brain that you are full are off balance. As a result, you're more likely to overeat. That's another important one. Again, there's direct evidence showing that those two are related to each other. Risk of heart disease, that goes along with the high blood pressure. There's chemicals linked to inflammation, both of which play roles in heart disease, the blood pressure, and the inflammation, as I mentioned. Poor balance even. So lack of sleep affects your balance and coordination. These are all tied together. The poor memory, the balance, the concentration, the likelihood of injury from an accident because of lack of focus. So those are all detrimental effects. Now in the next video, I'm going to talk about a few strategies you can use to help you get better sleep, to help you fall asleep, or to stay asleep longer. And I know a lot of us, you get into routine and this is what I do and it's hard to change. I know, but there's a few really useful techniques I'm going to give to you in the next video to help you get to sleep and stay asleep. Make sure you watch that one.